A lot of people a couple months in feel like they want to quit, they don't want to do it anymore. Maybe you realize this isn't the specialty that you want to work in. I think the worst thing about being a new grad is pre-shift anxiety. Also very normal is feeling like you want to call out sick. Hey you guys, it's Miki. Welcome back to the channel. If you're new here, my name is Miki. I've been working as a registered nurse for about 3 years now. Today we're talking about absolutely hating your nursing job, and specifically your first nursing job. Around this time of year is when I get a ton of DMs, comments, messages from you guys that are starting your first nursing jobs, and you're saying that you don't know why you went into nursing, you're questioning all of your life decisions, and you don't know if you should quit, if you should continue on. And to be quite honest with you guys, these feelings are more common than you think. I went through the exact same crisis that first year post-nursing school. We're also going to talk about what's to be expected, what's normal as a new grad, and feelings that are not normal as a new grad, as well as some overall solutions for how to kind of clean up these feelings and get your first year in the bag. Before we get started, I want to talk about being a new grad specifically in the healthcare system, because I think a lot of the times we need to cut ourselves a little bit more slack because it's incredibly different as opposed to maybe starting a 9-to-5 office job. Your responsibilities are different. You are caring for real people and real lives are on the line, and that's an incredible amount of stress to endure. So I've organized, I think, the 4 major reasons that working as a new grad in healthcare is incredibly stressful. And number 1, it's because you're learning on the job. You already spend so much time in nursing school. I personally spent 4 years of undergrad in nursing school, and you learn so much information, but it isn't until you actually start working your nursing job that you realize how much you actually don't know. I would say that maybe nursing school is really the foundation, maybe 20-30% of what I needed to know as a nurse, and then the rest of the 70% was something that I had to learn on the job. And that's really scary because when you're learning on the job, the person that you are learning on is a real life human who maybe is somebody's mother, maybe it's someone's child, it is somebody's loved one. But inevitably, as a new grad in healthcare, you have to learn how to put in your first IV, you have to attempt to have your first crucial conversation, and these are happening in real time. There's no simulation. Reason number 2, I think in every industry there are seniors or coworkers that are incredibly difficult to work with, but especially in nursing, nurses eat their young. And I wish it wasn't true, but when you get on a unit, you will see that the older nurses are kind of cliquey and feeling that they have so much experience in that specific terrain, and then you are young and fresh and coming into this space and they feel a little bit threatened. I remember giving a report very specifically to an older nurse, and this is a patient who had a trach and a G-tube chronically for over 10 years, and she kept pestering me about specifically when did this patient get this G-tube, and I was like, I don't know, if they've had it for, you know, pretty much their whole life, and they kept asking me for this specific date. And when you're a new grad and you already know so little, your ego gets bruised so easily. So it's little things like that that really just send you home crying. It's a culture that needs to change, but it's very much a culture that is present. That kind of leads into the next point. You constantly feel defeated. I'd have to say that going into work every single day for the first year, there were things that I had absolutely no idea how to do. A new dressing that I'd never seen before, a new diagnosis I'd never seen before, having to take the patient to CT, to MRI. I think a healthy learning environment is when you are reinforcing the things that you already know and then learning a bit of new stuff on top of that, right? You feel very healthy because you're getting positive reinforcement and then also learning a bit on top of that. But working in healthcare is a little different. Every family also emotionally handles things very differently, and so learning to deal with different types of humans, I think, also is a challenge in itself. And then finally, the absolutely horrendous schedule that you get as a new grad. Now, this really depends on where you work, but a lot of the times there is a lot of seniority involved in terms of scheduling hierarchies and who gets first pick. As a new grad, I had to flip-flop days and nights every other month, so I was working days and nights and days and nights, and I did that for a whole year. When you're a new grad, there's like limits. So for example, they don't want more than 2 new grads working at a time. I remember that there was one time on the schedule, I was working every other night shift for 2 weeks straight. I don't think anybody wanted to screw me over. It wasn't intentional, but it just ended up being like that. Sometimes you also don't know how to advocate for yourself and stand up for the things that you really deserve. In healthcare, we have the beauty of of a 24/7 care, right? The hospital never stops, and so somebody's got to work night shifts, somebody's got to work the weekends, somebody's working the holidays. And as a new grad, unfortunately, most of the times you do get the short end of the stick. Usually the older nurses do have seniority and have priority when it comes to scheduling, and that's to be expected. You know, I don't think anyone is intentionally out to get you with a schedule, but unfortunately you do get the leftovers, and a lot of the times they aren't that great. And in a time when you already don't really know what you're doing, and you have a horrible schedule, and people are being mean to you, I think all of those factors in combination can really take a toll on your emotional well-being. Next up, I want to talk a little bit about feelings that maybe be very normal and the specific feelings that I experienced and when they started to feel better. So I think the worst thing about being a new grad is pre-shift anxiety. If you have ever worked in healthcare, you know exactly what I'm talking about, but it's that nervous feeling maybe the night before you go into work, maybe it's 3 nights before you go into work, about not knowing what kind of patients you're gonna get, not knowing what kind of assignment you're gonna get, and this anxiety about impending doom that you won't know how to handle the situation that comes up. That anxiety is not a feeling that goes away for a very long time. I would say the anxiety was worst within the first 9 months, and between the 9-month and the 1-year mark was when it started to slowly feel better and better. In terms of dealing with pre-shift anxiety, I think, you know, you have to figure out what works best for you. So when I clustered my shifts together, when I was on for 3 in a row, even if my patient assignment wasn't the same, my pre-shift anxiety was way lower because I basically only had that anxiety before the first of the 3, as opposed to if I had a break in between these shifts, and I would have that anxiety all over again. And so figuring out a schedule that works for you, that works for your body. Maybe it means advocating for yourself with the charge nurse and saying, hey, if there's any way that you could keep this assignment for me for, you know, the shifts that I'm working this week, that would be really appreciated. And so communicating that with other people, I think, is incredibly important. Also very normal is the idea of feeling like you have no idea what you're doing. Most of the times you actually know a little bit more than you think you do and that you give yourself credit for. Just know that it is completely okay that if you don't know how to do something, to ask for help, to ask a charge nurse, to ask your mentor, to ask a preceptor, to even Google something before you go in and talk to the patient about it. Nobody expects you to know all of this information. Months in, I was still passing medications that I had never heard before, and every single time I would go into micromedics, look up all the information that was pertinent so that I knew what I was giving to the patient and so that I could explain it to both the patient and their family. While it might slow you down a little bit and it's terrifying because you're already so bad at time management as a new nurse, those extra minutes are incredibly important and conducive to your learning. Also very normal is feeling like you want to call out sick. I wish more people talked about this, but in the same way that if you're gonna call out sick because you have a cold or a fever, it's also okay to call out sick if you need a mental health day. Whatever it is that you need, if you need to take a day off, obviously don't call out sick every other week, but if you need to call out sick for a shift and take care of yourself and your mental health, I think that's completely okay. The truth is that there will always be learning opportunities. There will always be more days to work. You have the rest of your entire life to build your career, so taking a day off here and there is not going to get in the way of that. And anyways, that sick time bank is there for a reason. You should use it if you have it. Making sure that you are talking to your fellow new grads, maybe on your unit or even in your cohort, is so incredibly helpful because chances are other people are going through the exact same things that you are. I personally had a mentor who was 1 cohort above me, so she started as a new grad 6 months before I did. So she was just right ahead of me, and anytime I was feeling any of those feelings, I would text her and she would reassure me that those feelings were very healthy and very normal. A lot of people a couple months in feel like they want to quit, they don't want to do it anymore. Maybe you realize this isn't the specialty that you want to work in. The harsh reality of quitting your job as a new grad is that if you were to quit, you already have RN experience working as a new grad, so 1, that disqualifies you from starting other new grad programs, and then 2, you don't have quite enough experience to land a different nursing job, so you're kind of stuck in this weird place. If I were to be completely honest, my biggest recommendation is to stick it out for the first year. It absolutely does get better at the 1-year mark, but you have to see it through and you have to work incredibly hard in order to come out on the other side. After you have a year or maybe 2 years of experience, The world is your oyster. As an RN with experience, you can move to any unit, any state, any specialty. You really have your pick of job. And then on the flip side, I want to talk to you guys about what is absolutely not normal, things that would be incredibly big red flags to me. Unsafe patient assignments. Now, unfortunately, with the pandemic, we're seeing this more frequently than we ever have before. If you feel like your job is putting you in a position where you are unsafe and that you could potentially lose your license for how unsafe you are being and you're not able to provide the level of care that you feel like your patients deserve, that is a really big red flag. I would never risk the license that you have worked so hard for because there are always other options and alternatives that you can pursue. And then obvious red flags, discrimination, harassment, things like that are never okay in any job, any setting, especially not in a healthcare one. And those are non-negotiables for why I would absolutely and instantly quit a job. I hope this video gave you a little bit of insight about what is normal and expected as a new grad. I promise it does get better, but unfortunately, I think everyone is probably in agreement that the first year of any job is probably the worst. I would love it if you guys left a comment down below, whether you are a new grad going through these feelings right now, or maybe you're a seasoned, experienced nurse who's already come out on the other side. It'd be great if you could leave some advice for new grads. As always, don't forget to hit that thumbs up and hit that subscribe for similar content, and I will see you guys next time. Bye!